Nurses are with the patient in sickness and in health.
Every year, thousands of students face one very tough decision: medicine
Or nursing.
both save lives, both work in the hospital,
Both can take you abroad, but are they really equal?
and more importantly, if we could go back to the very beginning, would we still choose our professions?
And today, we'll be giving you the honest truth. Hi, I'm Dedayo.
And I'm Tutor Enoch, a fourth-year medical student of the University of Ibadan.
I'm Dedayo, a fifth-year nursing student of Ladike Akitola University of Technology. A lot of people have questions. Medicine or nursing? Do nurses only have to work at the hospital?
Do I have to be all intelligent to study medicine?
Let's give our honest reviews.
So, Dedayo, why did you choose nursing? Was it more of personal motivation or was it family influence?
Well, a lot of factors actually played roles into why I chose nursing as a profession. Initially, I never wanted nursing or medicine. I actually wanted to become an architect.
An architect?
Yes.
Really?
Yes. I actually have two different WAEC results, one as an engineering student and the other as a medical student.
Wow, that's the height of determination right there.
I wasn't really sure what I wanted to choose, but at the same time, I didn't want to put all my eggs in one basket. So later on, I tried to say, okay, let me go for medicine. And when I wrote my JAMB, I discovered that my score was not going to get me medicine. So it was going to be very competitive. So I opted out for nursing. Initially, I never liked nursing because I felt like nurses were slaves to doctors.
Oh, you are doing nursing now?
Yes, and now I have grown to love it because I know that there is nursing beyond the bedside.
What was that turning point where you, from going to I hate nursing or I don't really like nursing to I love nursing now? So that's something I want to do for the rest of my life.
Okay, we had a particular professor at our school that actually gave us the right orientation, and she made us to discover that there is nursing beyond the bedside. I don't necessarily have to work in a university. I can be a forensic nurse.
Forensic nurse?
Yes. I can be a nurse in law. I can be a nurse photographer.
Nurse photographer?
Yes. I can be a genetic nurse. I can be a research nurse. I can be a nurse educator. Yeah. I can also be a cosmetic nurse. Yes. I don't necessarily have to work in hospital.
Okay, so Dedayo, why not medicine?
Well, I actually wanted medicine before, like I did say earlier. But when I discovered that the JAMB score I had at that year would not get me medicine, and I would have to write another JAMB again, making that the 5th or 6th JAMB I'll be writing.
Wow.
So I needed to, after 4 trials, I needed to ensure that I get to the university already. That's why.
And now it's more like destiny for you.
Yes, because I feel like God wants me to be here. I am supposed to be in nursing.
So because of that notion that people have, if not medicine or nothing, sometimes I just advise people to go another route first.
Yes.
Then if you maybe you get admitted into a course like biochemistry, follow that route through. If you're able to cross, then it's fine.
Well, I am not really a fan of that because I am always a fan of chase your dreams and get what you want to get. Now, talking about the course biochemistry, that's a little side attraction. Whenever you want to choose a course in Nigeria to study, you have to ensure that that course is of great importance and value in the economic market.
That's true.
Not studying a course, like imagine studying history in a country that doesn't even take its history seriously. That's like, I wouldn't say a waste of time because those courses were placed there for a reason. But do not just go to school because you want to go to school. Go to school because at the end of the day you'll be able to use your certification.
That's one good word right there.
Yes. Okay, Tutor Enoch, can you tell us about why medicine appealed to you? Was it family pressure or your own passion? And why not nursing?
Okay, so medicine appealed to me because I originally used to like neuroscience. I was fascinated about how the brain works and psychology in general. In fact, it led me to wanting to study a book, The Psychology of Women, because I was why are you laughing at me? Because I always wanted to know how I can check some girls, but Jesus has helped me today. But I was fascinated about the mind working of human beings, and also from there I knew that there was a difference between neuroscience and neurosurgery.
Yeah.
And initially I wanted to do everything neuro, like lay my hands upon, but yeah,
Do you still want to do it?
the dreams are tilting towards more at least more specialties that won't take my life.
Because neuro is a lot.
But if you have it in mind, I would say you should chase your dreams and go for it. Nevertheless, it was just like something that I would love to do for my own case. All right, so from there, and also, there's this notion that if you are the best in your secondary school, automatically it's either you become a doctor, you become an engineer, a nurse, or a lawyer, or an engineer. And from there, I just think that okay, they used to call me doctor when I was this thing. I already like neuroscience. 1 + 1 give us 2. So let's go for it. I shot for medicine, and I got. Well, I didn't got it. I didn't get it at the first instance, but later on I tried again. I got it. So I was also like, okay, I think I'm meant to study this thing. So that's how I got into medicine.
So a good question.
Okay.
You said you wanted to study psychology of women because you wanted to type.
Why are you bringing this
I'm
conversation?
gonna bring it up. So
Okay.
now that you're in medicine already, are you still typing women?
No. God has helped me. You need to have had that part. Anything we are doing now, we are doing it for formal purposes. It's to the end of marriage, not to the end of. Okay, so Didayo, imagine I want to study nursing again from the beginning. What is the admission pathway? Is getting admission into nursing, is it easy? And do I need to do JAMB? Is it only JAMB I can go to get into nursing? Can I also do direct entry? And what is the cutoff mark actually like?
Okay, thank you so much, Tutor Enoch. That's a very good question. Now, there's nursing in university and there is nursing in nursing school. I'm currently studying nursing at a university. So nursing at a university is 5 years, and nursing in a nursing school can be 3 or 4 years.
3 or 4 years?
Yes, depending if you want to get a BNSC or ND or HND. That's a topic for another day. Now, the requirement for you to get your nursing admission. Over the years, nursing has become very, very competitive, and people want to become a nurse, all because of the JAPA syndrome.
Can you just? I was just saying, competitive. That's how rich nurses speak.
It's very competitive, and people want to JAPA, and so a lot of people. Before you actually get your nursing admission, you need to be a science student first of all. Have your right combinations in WAEC, physics, chemistry, math, English, and most importantly, biology, and any other 2 or 3 more combination. And in JAMB, you're supposed to write chemistry, physics, math, and biology. Those are the 4 subject combination for you to get admission into university. Because now nursing now takes JAMB is a prerequisite for you to gain admission into university. So you need to get JAMB first. And also different universities have different cutoff. Like the UI, for example, can decide to take a 280 cutoff for nursing, and my school can decide to take a 260 cutoff. All importantly, just ensure that you aim for a very high JAMB score.
Yeah, that's actually for that cutoff. Now, there is, if your school is writing for UTME, you don't just use your JAMB score or the JAMB score. That's
Yes.
Yeah, so that's where the change comes in. Those who just think the JAMB score is the cutoff. For many people, because I get a lot of people asking me that question. You can watch my previous videos on things like that for you to understand.
Yes, thank you.
Okay, so Didayo.
Yes.
Most people usually see, especially in movies,
yes,
they don't get to see what doctors are really facing. So, what is a typical day like, or nurses are really facing, right?
Yes.
So, what's a typical day like for a nurse? Patient advocacy, managing patients, staying the bedside and everything. What is all of that like for a nurse? For someone who is trying to get into nursing, what is it like building relationship with the patient? All of that. What really happens in the hospital?
Yes, thank you. First of all, Tutor Enoch, I am still a nursing student. Yet to write my professional exam this year, so I can still speak for nurses because I am going into that profession. The importance of interdisciplinary relationship cannot be overemphasized. Everybody in healthcare plays a very important role, down to the health assistant, down to the registrar, down to even
the
non-medical staffs. They play a very important role. But one thing about nurses, and one thing I like about the nursing profession, is that we take our relationship with patients very seriously. Unlike that of doctors and patients.
Wow.
No, I'm not throwing shades here. Doctor-patient relationship. Yes, doctor-patient relationship is only in sickness. But nurse-to-patient relationship is in sickness and in health.
Wow. So this thing whereby they say in sickness and in health, I'll agree with you. So doctors can relate.
Yes, you can relate. Nurses are with the patient in sickness and in health. Meaning, we also look at other non-medical factors that can be influencing the patient's illness. We look into the family history, into the work history, into the lifestyle. You take family history, but you do not really care about how the patient is feeling after the medication, after other non-medical factors. So we are with the patient through thick and thin.
Literally, they are good. That's why they make very good wives, and they make very good spouses as well.
Yes.
So if you want to marry a nurse, although I'm probably not going to marry a nurse.
That's your choice.
Let's talk about documentation in the hospital.
Yes.
There's a lot of, when you come to the hospital and a patient's case note is missing, and because of that you can't get to attend to the patient for the documentation system now in Nigeria is permit me to use Nigeria, but what are the loopholes that you have seen in the documentation system, in the healthcare system, and what do you think can be done to actually fix it?
Okay, I did say earlier that nursing has to do with hard work and dedication.
Okay.
Now, there's one thing we say in nursing: if it was not documented, it was never done. That is why you see that in the hospital, the doctors have their own documentation separately, and the nurses have their own documentation separately. Although these two people work interdisciplinary collaborations to ensure that there is optimal care for the patient, we still ensure that each and every one of us document our findings. That is very important. And the thing is, as I said, you can never be lazy and want to study nursing, because you not documenting something can be very fatal to the patient's health, and it can also cause a legal issue. That is why we say in nursing, if it was not documented, it was never done.
That's lying. That's a lying. It was not documented.
It was never done.